So since we're a new hospital, it's not like we have, a lot of before and after. So we have mainly the after part, right? And so the before part, we have to sort of take from the past experiences of our prospective patients and our stakeholders. And so one of the things we did was we during COVID time, we actually did a digital workflow and redesign the workflow so that the vaccination and the COVID testing was very smooth. And as a result, we gave away over 300,000 doses of COVID vaccine, the government vaccine at that time. And also, we never had to close down our COVID testing drive-through, while some other hospitals, they had to close down because it was a lot of traffic, when there was a peak traffic, they couldn't take on most of the traffic. And so, because we did our redesign of the flow, we were able to stay open the entire time. And also, one of the things that we did was with our My MedPark app, actually, we got a lot of inspiration from some other hospitals from abroad, but it never existed in Thailand, which was like the immediate confirmation, real-time confirmation for doctor's appointment. And so in My MedPark, you can actually book a doctor based on their real-time schedule and get immediate feedback, immediate confirmation without having to wait for a person to confirm. And that's very convenient for our patient. Another thing in the app that we did that was really different from anyone else in the country was that we have a message care team feature where you can actually message your doctor who you have seen in an outpatient clinic before, follow-up questions. For example, when you see the doctor, sometimes you're sick, and you're not quite together and you forgot to ask some questions, or maybe you've been prescribed some medication that you had side effects while taking. And so you can consult with the doctor without additional fee or having to come in again. So I think healthcare is too complex for any single discipline to solve problems for. So I think that the key thing with innovation in terms of healthcare is to do co-creation. And if you do co-creation means 1 + 1 = more than 2. So basically, all of your efforts, combined, is more than the summation of all your individual efforts together. And so, because our problem solving is like so complex, I don't think a lot of startups have, the complete multidisciplinary people working together. Sometimes, some startups will not have a medical team working with them, or the other way around, some medical team who are trying to come up with new innovation, they don't have service designers or engineers or the patient advocate working with them. And so every time, most of the time, some aspect is missing, as in sometimes it's the patient's aspect, sometimes it's the medical professional aspect. And, the reason we need co-creation is because we want to be able to create something that people will actually want to use. So a lot of the times you find that a lot of companies who are creating these innovation, who are not, working enough with hospitals and doctors, they come up with solutions that hospitals don't really need or doctors don't really need, and that's a waste of effort. And the way to do this better is to co-create and work together from the start and come up with something that is already in demand and something that would actually solve problems for providers. One of the things that I wanted people to know about MedPark was that we're a physician-owned hospital, and that is basically co-creation from the ground up, from the structure of our shareholders. That has 25%, top-notch doctors who were invited to not only financially invest in the hospital, but also create the hospital from the ground up, side by side with the architect and drawing out the floor plans, from scratch together. We wanted to show that it is possible to create a patient-centric experience through co-creation, and that is an example how we can do that in real life. And also how patient-centric solutions can really create, a great patient journey, and how, Thailand is very, standing out in terms of hospitality and patient experience, and also, the complex, medical care. So we wanted to show how design can really truly affect patient experience and patient outcome, and how Thailand is the medical hub that can help with a lot of complex cases, as well as providing, a patient-centric experience and journey for the patient around the world. So I think both events really complement each other. The Medical Fair Asia happens in Singapore. That one is more of a global setting. It's more of a global market in the ASEAN environment. There are a lot of vendors and exhibitors who are very, very interesting. But Singapore is sort of like a medical hub. It's sort of like a hub for ASEAN. But for Thailand, Medical Fair Thailand is more, I think it's also focused on ASEAN as well. But there's a really big opportunity because Thailand is a very fast growing in terms of healthcare hub. And there's a lot of opportunities, a lot of hospitals, new hospitals coming up, a lot of clients, a lot of vendors and distributors existing in Thailand. So this is a very big market that has a lot of opportunities. So I see Medical Fair Asia as sort of like a long time coming global market, and Thailand as a more of like a fastest growing, medical hub in ASEAN.